My name is Danica Pierce, and I am a licensed clinical social worker here at Northern Nevada Hopes. I work in the clinic as a behavioral health provider as well as the MAT program coordinator.
Why are opiates so addictive?
So, as many people know, we are experiencing a pretty significant opioid crisis in our country. One of the reasons why opioids are so addictive is because of the way that they work in the brain. So when somebody becomes tolerant to opioids, what ends up happening is that they eventually will need opioids to feel normal. And without them, they will feel very sick. And so what happens is people go from using opioids to get a high to using opioids to just avoid being ill.
What is medication assisted treatment?
So, medication assisted treatment is a form of treatment that we use when treating opioid use disorder. We can also use medication assisted treatment for alcohol use disorder as well. And what it is the use of medications that help support somebody in recovery. So, the way that I like to describe it to people is that medication assisted treatment is like using a scaffold in the brain. So, if you think about a scaffold during a project, a building project, for example, first, a scaffold has to be built, which allows workers to get up on the building and do whatever it is that they need to do the project. And then once the project is completed, the scaffold comes down. And that's sort of how we use medications. So we use medications that really stabilize the brain and allow an individual to focus on the other things that they need to do to maintain recovery. Recovery looks different for different people. And so for some people, re-engaging with family, being able to maintain responsibilities, going to therapy, going to self-help groups, engaging with their church or spiritual group, all of these things that sort of contribute to a meaningful life are things that people need to be able to do to maintain recovery long term. And the medication is really just one tool in our toolbox that stabilizes an individual's brain so that they can do those things.
What is naloxone?
So, naloxone, which is also known by the brand name Narcan, is an overdose reversal medication. So, it's a medication that if somebody is experiencing a life threatening opioid overdose, we can give them this medication and it will immediately stop an overdose. Naloxone is available here at Northern Nevada Hopes. Anybody can come to our clinic, whether they're a patient or not. They can come to our pharmacy and get naloxone for free. We also offer naloxone at our harm reduction center, which is also known as Change Point, which is also on our campus. And I strongly recommend that anybody who has opioids in their home for one reason or another to have naloxone at home as well. Opioids are particularly dangerous to children, and having naloxone at home just in case is always a good idea.